I'm a 20-year-old man. I feel demotivated when I see my eyes. These are like I have holes under eyes. I'm having lots of problems with under eyes at a time, like eye bags, dark circles, blackheads, wrinkles. I feel very bad about this. I'm using under eye cream for almost 7 to 8 months, but no improvement. Please suggest anything so I can feel good. I feel very bad about it. Help me, please.
Thank you for your question. You stated in your question you're 20 years old and you feel very demotivated about your situation, and you describe your under eye area as having puffiness, dark circles, blackheads, and you've tried creams and you're looking for some guidance, and you've submitted 2 photos. Well, I believe I can give you some guidance. I'm a board-certified cosmetic surgeon, and I'm also a fellowship-trained oculofacial or oculoplastic surgeon practicing in Manhattan and Long Island for over 20 years. My background training in oculoplastic surgery began with eye surgery residency, followed by advanced training in cosmetic and reconstructive surgery of the eyelids, and performing eyelid surgery is a very significant part of my cosmetic surgery practice. So when I look at someone like yourself, and just with the photos alone, I always think about what is the dominant feature. Certainly when you have a list of concerns, it's important, but at the same time we want to create some type of a hierarchy so we can have a rational approach to how to address these issues. So for me, when I look at your eyes, the first thing that I see is puffiness. And that's usually the case for a lot of people because the puffiness still dominates. Now let's say for argument's sake you wanted to do something to improve the under eye discolorations, or you wanted to do something to try to camouflage the puffiness. If the puffiness is the dominant feature, then those other treatments don't have the kind of impact unless you treat what is dominating. So I think that we need to really focus in on that. Now, what causes puffiness under the eyes in a 20-year-old man? Well, essentially, the majority of time in our practice, we see patients who have similar issues. It's genetic, lower eyelid, fat prolapse. Now, what that means is that there is a family history or a family trait that gets passed along, and the fat that's normally around the eyes actually prolapses forward and creates these bulges of fat. This is one of the many reasons why the creams that you tried did not succeed. There's no shortage of creams that claim to help under eye puffiness, but the reality is when you have fat pockets, none of those creams can work. What we typically do for someone like yourself, and again this is without a physical examination, you have an option. If it's slight lower eyelid puffiness, we can camouflage that puffiness with with a filler such as Restylane or Juvederm. But typically when someone has genetic puffiness and is significant, then the more definitive procedure is something called lower eyelid transconjunctival blepharoplasty. Now this means that what we're doing is we're addressing the fat pockets surgically from behind the eyelid, from the inside. Now that might sound daunting, but what we've done in our practice is we perform our surgeries under local anesthesia with light sedation in our Joint Commission approved facilities in both our offices. This takes away a lot of the concerns that people have about the scary word surgery. But when you think about it, the way we do this procedure, it is so minimally invasive. What we're doing is we're going from the inside of the eyelid and making a small opening and getting to the fat pockets and actually definitively treating the underlying issue, which is the fat prolapse. Many times patients come to us who have had this similar type of situation, but instead they have all of this filler placed around their eyes, and it makes their eyes even look puffier. And for them, what we do is we use something called hyaluronidase, which dissolves the hyaluronic acid or the Restylane, Juvederm, whatever they've used, to help reveal what the real issue is. But in your situation, I would start with that. I would probably address the discolorations with platelet-rich plasma, This is derived from your own blood, and it is used to help stimulate collagen and improve blood supply. Although it's generally reserved for people with more age-related issues, we've found that very often when we're treating a younger person with these discolorations, there is a successful synergy of reducing the puffiness and improving skin quality to yield a better result. I think it's important that you meet with qualified, experienced cosmetic surgeons and learn about these options. I think you've reached a plateau as far as your self-treatment, and as difficult as it may be to at least have this discussion, I think going out and meeting with doctors and learning from a three-dimensional examination what the situation is for you, and maybe trial other things, but usually when you have an issue, it's better to treat the issue rather than treat around the issue. So I think that that would be the way I would go, and I think that once you're comfortable with the doctor, you'll find that having this treatment, your eyes will really look a lot better. I always say that lower eyelid surgery or addressing puffy bags under the eyes is like having a facelift. It really just brightens up the whole face. So I hope that was helpful. I wish you the best of luck, and thank you for your question.